We're going to begin. I am Jeffrey Kluger from Time Magazine, and our panel this morning is about health diplomacy. And I had just a quick opening thought or two, and then we're going to introduce our group. Diplomacy can take all kinds of forms. There's traditional diplomacy with its kabuki theater of black cars and red carpets and secret talks behind closed doors. There's cultural diplomacy, like the recent trip of an American symphony orchestra to North Korea. There's sports diplomacy, like the famous ping pong opening between the US and China in the early 1970s. There's even space diplomacy, like the Apollo-Soyuz mission conducted by the US and the USSR 34 years ago this month. But there may be nothing so powerful as health diplomacy, when the people of one, sometimes hostile land, step in to help the people of another. Every crate of medicine with an American flag stenciled on the side, or every French-born doctor from Médecins Sans Frontières who helps a village in sub-Saharan Africa, touches people in a way no ambassador's delegation ever could. Our panelists this morning are uniquely equipped to discuss such things. With us are Dr. Norman Neureiter, Director of the Center for Science, Technology, and Security Policy at the American Association for the Advancement of Science. Prior to that, he was a distinguished Presidential Fellow for International Affairs at the National Academy of Sciences. That followed a 3-year assignment as the first Science and Technology Advisor to the U.S. Secretary of State. Two over is Anneta Hewko, Vice President of the International Branch of Susan G. Komen for the Cure. She guides the development and management of the group's growing global programs. Prior to coming to Komen, she was Director of Health and Wellness for PepsiCo. Between those two is Dr. Robert Sebbag, Vice President of Access to Medicines at Sanofi Aventis. I want everyone here to correct me, by the way, if I mispronounce names, affiliations, or companies, which I'm sure I've done 3 times so far. He has a leading role in the company's Access to Medicines program for the Southern Hemisphere. Prior to coming to Aventis, he worked in Brussels for the European pharmaceutical industry. He also worked as a Senior Vice President of Communications for the vaccine company Aventis Pasteur. And finally, at the end, is Dr. Alice Dautry, President of the Pasteur Institute. She trained as a physicist at the University of Paris and a molecular biologist at New York University. When in the United States, she conducts research and teaches at the National Institutes of Health and the Massachusetts Institute of Technology. I hope I got all that right. And we're going to have just a quick 5-minute statement from each of our panelists. I will then guide a conversation for the next hour or so, and we will also open it up to questions whenever we have run out of things to say. So Dr. Neureiter?
Look, international science and technology cooperation is really an imperative for the conduct of modern science and technology. And it's well known, there's a lot of it, and in fact, someone who works in a given field, in his or her particular field, certainly knows what's generally going on in other parts of the world. But science diplomacy is to us at AAAS, and to me personally, a subset of that, and a very special subset. And the way we define it, it's using science and technology cooperation as an instrument of peaceful engagement. It's kind of a soft power instrument of a constructive foreign policy. And it's science cooperation undertaken for foreign policy reasons, particularly with countries where relations are not good or in fact quite hostile. Now there's also some other things. There's science in diplomacy. For example, you have a big issue, take acid rain, which was a big diplomatic issue between the US and Canada. Clearly, science had to contribute to the solution of that, but that was science in diplomacy. Then there's diplomacy for science. For instance, take the Antarctic Treaty. When nations wanted to do research, you had to bring the diplomats into the picture to work out the arrangements, the Antarctic Treaty, the regulations which sort of managed that, and people did not get into conflict in the Antarctic. Now, what I'll do, but I'm going to talk about science diplomacy and some things over the last really almost 40 years that I've been involved in. The first one was under President Kennedy, way back in 1961 with Japan. Maybe some of you remember that he picked Edwin Reischauer as his ambassador to Japan. And Ambassador Reischauer wrote a famous article for Foreign Policy magazine called The Broken Dialogue. And what he saw was the Japanese universities really leaning toward communism, sort of a revulsion against the Japanese militarism of the war, and falling for the idealistic view of communism. And so what he said is the dialogue between our intellectual communities is broken, and we need to do something to fix it. And so at a dinner at the White House in 1961, for Prime Minister Ikeda of Japan, Jack Kennedy raised his glass in a toast and created 3 committees, an economic committee, a cultural committee, and for the first time, a joint scientific committee to try to fix the broken dialogue between the intellectual communities of the 2 countries. The National Science Foundation in the US was given the responsibility for managing this relationship and developing some relationships with the scientific community in Japan. And I just happened to join NSF I had a research career in an oil company in Texas and wanted to do something in the international sphere. So I joined the international office of NSF at that time and ended up being the manager of that program. And you can imagine where Japan was in those days scientifically, devastated by the war, and the US was on top of its scientific game. So America was here, Japan was here, and it was a bit of a struggle at first to find some joint projects which would be of mutual benefit and actually were good science. You can't do good science diplomacy with bad science, but it doesn't also have to be cutting edge. It just needs to be something of mutual benefit and interest. And we found some projects, and one of them was cancer epidemiology. High stomach cancer in Japan, high colon cancer in the United States. What are the reasons, and so on. So that was here a case where medical cooperation, medical-related cooperation was a possibility. Now, generally, Americans didn't speak Japanese, and certainly they didn't speak English. We worked with interpreters, but there was one American doctor who had somehow been born in Japan, I think of missionary parents, and he did speak Japanese, and so he was a tremendous asset in working this out. Interestingly, that was a successful program, and in a different form, of course. That program at NSF still exists today, which is remarkable. Another example is the Soviet Union, the relationship with the Soviet Union. We, at that time, in the 50s and 60s, each side had built up enormous arsenals of nuclear weapons. Some 100,000 nuclear weapons, if you can imagine, were built in the 2 countries. And they were looking at each other. And if there had ever been a nuclear exchange, none of us would be here today. We would have destroyed, effectively, the world if there'd really been a major exchange between us. Well, interestingly, this didn't begin with governments. It began with the individual scientists, and it was funded by a man who was vilified as the red millionaire, Cyrus Eaton, a Cleveland industrialist. And he had an estate in Nova Scotia called Pugwash, an Indian name. And he brought together nuclear scientists from the Soviet Union and nuclear scientists from the United States, and they began a dialogue saying, what can we do? We realize we're both building this thing. It could be terrible if we had a collision. What can we do? And these weren't little bombs we built in those days. The little one was Hiroshima and Nagasaki, 14 to 20 kilotons, 1,000 tons of TNT apiece. The Russians built one with 100 megatons, 100 million tons of TNT equivalent, and they got ready to blow it off in the Arctic, and Sakharov got scared, and he says, maybe we'll blow the Earth off its axis, or we'll destroy the northern lights or something. So they dialed it back to 50, and there's this tremendous picture of that great cloud which came up when that did go off. But anyway, that dialogue continued over the years. Pugwash continues to exist today. The group is dedicated to decreasing still the arsenals of nuclear weapons in the world. But those dialogues percolated up to both governments. I even interpreted once for Jerry Wiesner and actually President Kennedy with one of the Topchev representatives, and he was there talking with the Kennedy administration about the limited test ban treaty. And as you know, that was signed under Jack Kennedy. Later on came a comprehensive test ban treaty, but it's not been ratified yet by the United States, and actually that is one big piece of President Obama's program. Anyway, it also led to the arms reduction talks. They're also continuing today, and so that dialogue to me was very important. It was science diplomacy in action, but not begun by the governments. It was picked up later by the governments, but started by the scientists themselves. And then there was a third one with China. Am I running out of time?
We got about
okay.
1.5 minutes.
All right, well, I'll do it.
You're doing very well, though.
Anyway, the third one was with China. And at that time, I was working in the Nixon White House. And Henry Kissinger and President Nixon were preparing the trip to China. And Kissinger came to my boss, who was the President's science advisor. And this is really not well known. And he said, look, I want to give the Chinese something a little bit different from just the geopolitical repositioning in the world, something more tangible, something more concrete. Why don't you all work up some science initiatives, some cooperative science initiatives that I can take to China and show them that there's a little more in this than just the political issues that we're talking about primarily. And so he said to me, okay, Norman, this is your job. Go away and do it, but don't tell anybody. It's a big secret. Nobody must know that this trip is coming off. So over the next 2 weeks, and in the last few days with 3 or 4 sleepless nights, we put together 40 proposals, which in fact went to China, were laid on the table, and were part of the dialogue. And once that Shanghai communique was issued, there was actually a word in it about cooperation in science. Chinese delegations slowly began to come. They wouldn't work with the government. They would only work with non-government institutions like the Academy of Sciences in the US. But then in 1979, 7 years later, it's exactly 30 years ago, last January 29th, the first US-China formal science agreement was established. And in preparation for that, then President Science Advisor Frank Press had taken 19 federal agencies, the technical people, taken them to China, and came back with a whole rack of relationships. And today, the largest bilateral cooperative relationship we have in the world is, in fact, with China. And as you look forward, because there are people in Washington getting ready for the next war with China, and my own view is what we need to do is work just as hard, making sure that that war doesn't happen. And one key part of that is building these relationships today in science into true partnerships. And that is my vision for the next 30 years of that relationship. Anyway, there's a lot more that can be said, but I think I'll pass it on to our other colleagues.
Yeah. And we'll come back to this because there are a lot of very large themes you've raised that I'd like to address with you in the time that we do have. Mr. Sebbag?
Yes, I learned a lot. And it was very interesting. But I will put the topic perhaps on another way. I will speak about 2 worlds. One world before AIDS, and I will explain why AIDS has changed a lot, and the world today. Because to have such a debate today is not by hazard. You know, it's something has been changed. Now we can put everything on the table. And why AIDS has changed a lot? We have to remember the end of the 80s. The end of the 80s, okay, it was well known that AIDS was in the north and the south of the country. But in the north, we had a solution. We had the tree therapy with a very high cost, the antiretroviral drugs, more than 10,000 US per patient and per year. But in Africa, it was impossible. And we have discovered suddenly the pandemic in Africa, the epidemic in Africa. And the main problem, we say, okay, the patients are in the south and the drugs are in the north. And they have decided in the south, okay, to overcome, the intellectual property, somebody from pharmaceutical industry about that, and we have to put everything on the table. And to say, okay, we don't recognize patents, we don't recognize intellectual properties, and we need a combination because it's unacceptable that people in the South have no access to antiretroviral drugs. And if you remember, 39 big pharma, big company, has decided to make a lawsuit against South African government. 39 companies to say, no, we have some law in terms of business, patent, respect of intellectual properties. And in that time, we face where in terms of justice, you are okay, because of some law, you overcome the intellectual properties, but ethically speaking, socially speaking, it was a big mistake. How to make a trial, a lawsuit in a country where you have 6 million people HIV positive. And if you remember at that time, big noise in all the newspapers, all around the world, TV, radio, the bad guy of pharma industry, how it's acceptable they don't want access to medicine for these people in developing countries. And the only positive point was the strong awareness by pharma industry to say, oh my God, it's impossible to continue like that. We go directly on the wall. We have to do something, even if the responsibility big one, but it's not only our responsibility, we have to do something. First, awareness of pharma industry. The second point, very important one, and now we arrive on diplomacy. The rich country and the G8 in 2001, they decided to put money on public health in developing country. For the first time, they decided, okay, we can let a full continent like that, and it was the creation of the Global Fund. The creation of the Global Fund against HIV, TB, and malaria, it's really a revolution. For the first time, the richest countries have decided to put money on public health in developing countries. And now you have no more international meeting in United Nations, even if the last G8 was not very positive, they speak about public health. And public health became really a political topic. If you take United States, PEPFAR, 15 million US for AIDS. PMI, billion, sorry, yes. PMI, President Malaria Initiative, 15 billion for malaria. New actors, something new. Mr. Gates, from his own pocket, 30 billion US on a foundation. Warren Buffett, 37 is the same foundation. And now you have a private actor as Bill and Melinda Gates Foundation, with a budget 3 times more than WHO. It is a reality. And it changed a lot. And now also the international law on business, what they call Doha Agreement, they have decided about what is voluntary license, compulsory license, just to overcome the problem of intellectual properties. It's a new debate. And what I say now is, all the actors, and Alice Dautry with Aspen Institute as health embassy all around the world, play a role. Health became really a very important topic on diplomacy. If you take SARS, you remember SARS a few years ago. Now, swine flu. That's and right. It's no border. Everybody has to speak what you will do. You think that the flu will stop on the border of the United States or France and Belgium. No, how many vaccines we will manufacture for all around the world. And I think many topics, because the dream that infectious disease is finished. When I was a medical student, they say, oh no, don't worry, infectious disease now is finished with antibiotics, TB is finished, malaria, we have chloroquine and DDT. It's finished? No, not at all. Malaria is resistant. We have all the new bacterial, we have many resistant antibiotics. We have MDR and XDR, TB, AIDS, new disease, Ebola, SARS, flu, etc. It's why I think health has become really a very important topic of diplomacy, and not enough in the meeting. They have to speak a lot, because the relation of the people, why they need the people, it's not money, they need health for the population. It's why I think we have to put health and global health on the forefront of the international diplomacy. Finished.
Thank you. That also raises a lot of questions I'm going to want to follow up with. Dr. Dautry?
So I would like to add up to that. I think in addition to what Robert Sebbag said about AIDS, there was a next step which was very important, at least as I see it, which was SARS. And SARS was very important, not so much because at the end it was controlled very well, in fact, but it gave a lesson to the general public because one person flew from China to Toronto and stopped this rich Canadian city completely for several weeks. And the economy was completely stopped and was a disaster. And this one case within 24 hours that could stop a very big and modern city, I think gave us all, and especially the non-specialists, the idea that there was that we were all at the mercy of one person coming from anywhere with the diseases. And there it became, I feel, extremely political. And we have heard now very positive things about health diplomacy, and I will also bring very positive things, but I would also like to say some negative things. Not only health diplomacy as a way to bring peace, which I strongly believe is the case, and we do, and I'll tell you about that, but also as something rather negative. Because of what happened with SARS and then with the risk of avian flu, health became something with a value to the politicians of the world, which means wars, fights, struggle for power, and which was not the case before. I think there is a big change. What do I mean by struggle for power? And I know I'm a bit provocative, but I'm here to, we are debating, right? So struggle for power, I'll raise a question of strains. I mean, there was a big debate, there's still a big debate about avian flu, which, by the way, is not over. It's still going on. We don't talk about it because we talk about H1N1, but it's not over. It's still expanding. And the big debate about avian flu is all of a sudden developing countries realize that they had the power, although they were very poor, they had the power because they had the strength, they had the patience. And all of a sudden, some countries like Indonesia, followed by others, decided that they are not going to share the strain of avian flu when it happens. And as you know, right now, avian flu can only be transmitted from bird to man, not from man to man. What we all worry about is the day it mutates and it can be transmitted from man to man. And then we need a vaccine. And so the first place, country, patient who has this virus has power. And so there is a very big struggle which involves diplomacy, but in the more classical way. I mean, how do you fight between countries and with power so that at the end you share this richness of the world that everybody has to have, because we need the industry to make the vaccines, and if they don't have the right virus, they cannot do it. So health has become a political issue in the world with all the positive and negative sides of it, which is like the war, nuclear war. So now we also have health war. And this is one example I quote, but I could take another one. So, and I think this is something we need to think about. And of course, we rich countries, I mean the United States, and I come from France, and we are slowly losing the power we had, at least I would say so for the United States. I won't dare, but for my country I can. And we are clearly losing the power in general, in everything, including in health. And some countries are realizing that although they are very poor, they can hold us as hostages in some cases and use it for reasons that you can agree or disagree, but it's a fact. And this problem of strains is still not solved. So it's still something WHO is trying to organize, and it's still a big debate, and we still have not solved it. So coming now to the positive side of health diplomacy. And I'd like to say a few words about my institute. The Institut Pasteur has institutes all over the world. And actually, this was a vision of Louis Pasteur 115 years ago, when he thought at the end of the 19th century that the doctors and the scientists had to be where the patients were. And after he had discovered the rabies vaccine, he wanted to send his colleagues to vaccinate people in countries where people were suffering from rabies. And from that time, we created institutes all over the world. And now we have a network. We are at the heart of a network of 30 institutes, which are all over, many in developing countries, in Africa, Southeast Asia, and so on. So in fact, over the years, they are health embassies, quote unquote. Although we are scientists and doctors and don't necessarily think of ourselves as ambassadors. But in fact, we have been and are, whether we like it or not. And what is extremely striking is that our vision is we have to build peace in the world through health. And this has to be in the long range, so it has to be sustainable. We always think in terms of tens of years, not an intervention because there is H1N1 or Ebola or whatever. We think of very long term, build constructive relationship within countries, shared relationships where you work together, and no matter what the regime is in the country, and we have been in countries like Vietnam for 115 years, you can imagine the kind of changes there has been. And we stay over. And I'll give one example, the example of Cambodia. There was an Institut Pasteur in Cambodia which was destroyed at the time of the Red Khmers and burned, and people were killed and everything. I mean, like the story of the country, exactly following the story of the country. And then when in 1995 we decided to rebuild the institute, it was seen by the country as a symbol that peace was really coming and that the country was starting again open to the world. So this is one example of long-term relationship. And also we have, of course, a European and connotation. We work with the workers, with people in the country. The majority of the people working in our institutes are people we trained from the country and the region. And so in the long term, we build this kind of relationship. So we build friends in health, again, quote unquote. And I think this is very important. And this is what I would say, that health can be very positive in diplomatic relationship with countries. And I could quote other examples in Africa where the regimes have changed, there were revolutions and wars and everything, but we're still there and still working. Same with China. I'll take we have an institute in Shanghai, and because President Sarkozy decided to invite the Dalai Lama and so on, our relationship with China were pretty bad at some point. Are still not very good. But still, we have an institute, and still when I go to China, I visit the minister, although the relationship with our country is not good, but because we are private, we are a non-profit foundation, we are not the French government, so we can still do the diplomacy and continue over the years, build relationship, no matter what our governments are doing. And I think in the long term, it's extremely important. And I think, in a way, AIDS, as Robert Sebbag was saying, is a disaster for the world, I mean, of course. But it has some positive sides. I always try to be optimistic even when everything is terrible, so of course it's terrible. But the optimistic side is that we have understood, because of this disease, we, in general, all of us, not only the specialists, we have understood that we cannot have peace in the world if we don't have health in other countries, wherever they are. And as a result, all this international help is building up. It's not enough, but still it does exist. And also as a consequence, we are beginning to respect these people and work with them, because we all have learned that we have no other choice. It's our own survival. And this is, to me, a big change as to what was happening 30 years ago, 40 years ago. We know that we will not survive as a world in peace if we don't solve the problem of health and if we don't do health diplomacy. So this is what I would like to end on.
Terrific. Thank you. And Anneta, I thank you for your patience. And Anneta Hewko from...
Great. No, I think these are all really great setups for what it is that Komen does and the way we look at global health diplomacy, because all of these programs, if we really want to, we as the patient advocacy group, really want to be that bridge between the scientists and the medical community and delivering these solutions, whether it be breast health awareness or better care or better access to care to the patients themselves. And so our approach is really about starting at the grassroots. And that means that we need to identify local partners and individuals who know the local culture, who understand the community and have a credible voice in that community. And then we work together with our partners to be able to reach out to patients and really deliver the solutions. But we also recognize the importance of engaging at the grass tops, because really to create sustainable and scalable impact, we need to work at all levels: the local level, the national level, the regional level, global level, and with all the stakeholders: governments, non-governmental organizations, medical professionals, the advocates, and the patients. And so that's all nice and good, and I thought that what I could do is just share with you some examples of how we make that happen in our different engagements around the world. Just to give you a little bit of a perspective, over the 27 years that Komen has been in existence, we've invested over $1.3 billion in scientific research for breast cancer, in community outreach programs, education, and awareness building programs across the world. We've granted in over 50 countries, and most of our international grants have really only started about 10 years ago, and we currently have active community engagement in about 25 countries. So that's still small, but we're growing. And our first real foray, to be honest, into health diplomacy did start in a more traditional way with a diplomat. Our founder, Nancy Brinker, was placed in Hungary as the U.S. ambassador to Hungary. And there she sort of took her learnings from her experience here in the United States and started to help institute programs that would build awareness, and things like as simple as a bridge walk, which was similar to the race that we have here in the United States, to help build awareness. And in the course of some of this work, we've seen a decrease actually in the mortality rates of breast cancer in Hungary, and a lot of that is because raising awareness, something as simple as raising awareness, can lead to early detection, and we know that early detection saves lives, and that can be a direct impact on, certainly on global health. But we've gone on and we've founded a number of different partnerships. We are expanding. We've set up some guidelines working in partnership with the Fred Hutchinson Cancer Institute, the Breast Health Guidelines, and these help to identify approaches that can be used in low and middle resource countries for both the medical professionals and the patients to really be able to improve the screening and diagnosis of the disease. And we have some very successful examples in Latin America where these have already been put into place and are making an impact. And as a matter of fact, next month, Ben Anderson and I are traveling to Ghana to see a project where we'll be implementing those in Africa and Ghana. Again, on a more global scale, we are one of the founding partners of the Middle East Partnership for Breast Cancer Awareness and Research. And this was facilitated by the U.S. State Department in 2006. And we brought together U.S. experts, ourselves as the patient advocacy group, and MD Anderson Cancer Center in Texas from the medical side, as well as partners in the United Arab Emirates, Jordan, and in Saudi Arabia. And this partnership is really, I think, a successful example because we've mobilized organizations at the grassroots, including women's support groups and organizations in Saudi Arabia. And we've also ignited the interest and have mobilized the government and the medical professionals to really build out their infrastructure for breast cancer screening and treatment. And I think, to be able to accomplish that in a country where the social stigma about this disease is so incredible, women are ostracized not just by their families, but by entire communities if they have this disease. They're concerned that not only will it impact them, but one woman didn't want to come forward that she had the disease because she was afraid it would hurt the chances of her daughter to be able to be married. So to be able to have that kind of achievement, I think, in these kinds of cultures is really a testament to this idea of starting at the grassroots as well as the grass tops and working through all the organizations to really be able to make an impact. But for us, the event that really catalyzed the global breast cancer movement was a Global Breast Cancer Summit that we held in Budapest in 2007. What we did was we brought together delegates from 30 nations as well as the United States, and the delegates were selected based on their activities and their success in fighting breast cancer in their countries. And we paired the U.S. delegates with our foreign delegates. And we really opened it up for them to have dialogue about their successes, to share best practices, to share their challenges. And it was amazing what that was able to spark in terms of ideas and things that they could implement immediately when they go back into their countries, as well as some bigger initiatives. And you can't underestimate that sense of sisterhood and brotherhood that that created, and the strength that that gave to these people, who many of them are leading very lonely battles to be able to fight this disease and to raise awareness and improve the infrastructure for it. And that power of convening is something that we continue to replicate on both a local, regional, and a global level, because we really have understood what it means to help people to connect. But one very tangible initiative that came out of that was our global initiative for breast cancer awareness. This is something we do in partnership with the Institute of International Education, and it's becoming the cornerstone of our global initiative. And what we've done is we put together a curriculum, a core curriculum that we call Course for the Cure, that documents the Komen model, but also is very flexible and adaptable to the local culture. And what we do is we come into a country, we identify some of our lead partners locally, we then put together the training curriculum, we adapt the program to be culturally sensitive and appropriate for that country and that community. And then we train advocates, medical professionals, it might be midwives, it might be people from universities, from the local governments, and we take them through this curriculum. Then afterwards, I think what's the real power of this program is we help them conduct a community needs assessment so that they can really identify where the gaps are in their communities. And then we follow that up with a granting process. So what they're doing is they're taking their new skills and putting them into practice immediately, so you have an immediate impact on what's happening in that community. We've piloted this program in 9 countries, Brazil, Mexico, Costa Rica, Panama, the 3 Middle Eastern countries where we have our partnership, as well as Ukraine and Romania. And to date, we have granted over $300,000 in the Latin American and the Eastern European countries. And we've really seen some tremendous success. And we're working now to take that out on a larger scale. And one example I'd like to highlight from that, though, is one that I would hope we could replicate in so many ways. And it shows, again, the power at the grassroots and how we can, even from the grassroots, impact things in a bigger way. Where in Costa Rica, we made a $4,500 grant, not a huge grant, to an organization for a mastectomy patient rehabilitation program. That program was met with such success and it had such a good impact that the government is now putting in nearly $200,000 to replicate this program in other communities in Costa Rica. And for us, that just really feels like a tremendous success and a real tangible impact where we started small, but we could grow bigger. So there I could go on. I could give you many, many additional examples, but I'd just like to share one last example because this is something that we're really, really excited about. And as we talk about global health, this is really something big. You may be aware our founder, Ambassador Nancy Brinker, has a new ambassadorial role. Recently, she was named the United Nations Global Goodwill Ambassador for Cancer Control. We're extremely proud about this, and we're really, really excited about what this can do for the whole cancer community. In this role, she was going to focus on low and middle resource countries where the incidence of cancer is increasing at alarming rates, and we know that the support and the resources are extremely scarce. Just 2 weeks ago, Nancy addressed the UN Ministerial Conference on Global Public Health Goals when she was in Geneva, and she highlighted the fact that, as we were talking before, that actually cancer kills more people each year than AIDS, TB, and malaria combined. And yet, it's not one of the goals in the Millennium Development Goals. And so she went on to make a very compelling case for breast cancer control programs that would not just stem the human suffering of this disease, but also to help to reduce the economic burden in so many of these countries of this disease. And so for those of you who know Nancy, you can imagine the passion and the devotion and determination she's taking to this job. She's already begun working with governments, grassroots organizations, and NGOs. And we really believe that her work, combined with the kind of work that we're doing and all the other cancer advocates around the globe, can really, really begin to move the needle in terms of the impact of cancer and the cancer control on global health.
Terrific, thank you. All right, I'm going to ask one question of each of our panelists. Perhaps we can hold it to 3 or 4 minutes each, and then I hope we'll get some questions from the audience. And my first question for Dr. Neureiter, what about countries we willfully don't help? Is it ever moral to withhold assistance, to withhold diplomacy from nations we would consider rogue nations like North Korea for geopolitical purposes, knowing that their populations are suffering? Can we do that defensibly and morally?
It's interesting that the government has taken a position that they would not discontinue food aid, and even as things were very bad with North Korea, they were shipping in they committed to 500,000 tons of food. Actually, the North Koreans cut it off themselves because we demanded that Korean-speaking people go with them. Actually, one of my friends had done that. He has a private NGO. He's been working in North Korea for 11 years. He actually rather comes and goes rather freely to North Korea, which surprised me. I just met him a year ago. It's a group called Global Resource Services. Just fascinating that he's done that. And for the first time, he was distributing this past year some of that government food. And another friend of mine volunteered to go with him for 10 weeks, and they traveled all through the northern part of North Korea distributing the food. He showed some slides about it. Everything went fine. But when the North Koreans cut off the food because they wouldn't accept USAID's requirements for monitoring who was doing it and sending Korean-speaking Americans with him, anyway, that stopped now. So we're not doing that. What I did want to say is in our private public diplomacy, we at AAAS and the Academy of Sciences try to work with everybody. We've been trying hard now for 3 years to do some science diplomacy with North Korea. We have good relationships with the foreign ministry as represented by the people in New York, but so far we've not cracked actually getting into North Korea and trying to do a program. We have been quite successful in Iran, and you didn't mention, Alice, that you have a Pasteur Institute in Iran, and I'm actually eager to hear more about that, if not publicly, privately. But Iran is very important. I've been there a couple of times. We have very good relations with a certain segment of their scientific community, and and the key thing in this is you build some personal relationships. And those are important whenever there are changes. And I think that's an extremely important to mention. Secondly, you're working with a very educated elite group in these countries, and they do have an impact on the government as conditions ease in the world. So anyhow, we had a fantastic visit recently to Syria, met with President Assad for over 1 hour. He himself is an ophthalmologist, right? And we talked about the importance of some science cooperation. He says it's important for me in several ways. And one of them is I need to get more science into my industry and try to build up the economy in this country. And of course, medicine, there are over 200, I think, if the Cleveland Clinic person is here, there are over 200 Syrian doctors at the Cleveland Clinic, over 7,000 Syrian-trained doctors operating in the United States today. And so medicine is going to be a key part if we do manage to break the political barriers and have some more cooperation.
Great. For Robert, you spoke a bit about groups like the Gates Foundation and Warren Buffett and the great work they're doing getting money to the developing world. Have we overcome the inefficiency and corruption problem, what people like to call the M&M problem, money disappearing into mansions and Mercedeses for corrupt government officials? Have we cracked that problem, or do we still see a lot of graft-in inefficiency?
I will answer to your question, but first I want to make a comment. I think now what you say also, we are in the heart of the problem. Diplomacy now not belong to the government. It's a new diplomacy. The new diplomats is pharma industry, private institute, big NGO, university, etc. I can give you many examples. I was in Iran, not with my government, for technical reasons, a specialist on leishmaniasis because I had a problem. I was in North Korea for a problem of immunization, etc., but not for my government. And the problem, the government, they run after, as a new actors, about to know, to understand, because my country has no relation with North Korea. And they want to know, North Korea, what have you seen? I say, no. No, but I think it's very important. And health actors are the new diplomats, And it's sure that for many countries, it's much more important to have a meeting with Bill Gates. They will receive Mr. Gates in another way that they will receive President of the Ministry of Foreign Affairs. For many reasons. This is a reality.
Yeah.
And each time Mr. Gates is in France, he has a meeting with Mr. Sarkozy, and when we can understand he's 3 times more power than the WHO. No, but this is a reality. And the most important is that they are very professional, and they make good job. Okay, about your question. Okay, we face difficulties. We face because the life is not la vie en rose, as we sing in French. It is not everything perfect because how many children died every day? And we have technical means. We have immunization. You think it's normal to die from measles when you have good things for. Well, we face corruption is one. Corruption is one. To be sure that what we give, the money, the program will be received directly by the population. It's why we need local actors. It's the key. You can send all the good drugs if you don't have good people for the distribution to follow up. But what we have to I think it's a very strong point in terms of diplomacy is a brain drain from the south to the north. This is a reality. You think it's normal that we finance programs of education to train nurses in Zimbabwe or in Malawi, and they're coming in UK or in the United States or in France because we need nurses. Human resources, I think, is the key issue now in developing countries because drug is only a part of the solution. Vaccine is only a part of the solution if you don't have people, human resources, etc. It's why to have some institute locally to work with local people, to train local people is something very important. This is a key diplomatic point today. But we are the new diplomats.
And just as an aside, well, no, in confirmation of that, actually, a couple of years ago, Time Magazine sponsored a global health summit in New York City, and Bill Gates and Bill Clinton were on stage together being interviewed, and somebody brought up, perhaps jokingly, the idea of Bill Gates himself running for president one day, and President Clinton responded, well, I'd vote for him, but he'd have less power than he has now. And I think there's a lot of truth in that. Dr. Dautry, you spoke about SARS, you spoke about avian flu. Do we have, this is a somewhat specific question, but do we have the global cooperation in place now for a proper surveillance and field monitoring defense against the arrival of avian flu or H1N1 in the fall? And how much of this did we learn from, say, the SARS experience, or did we not?
Right, so I can answer that. So because we are the heart of a network of institutes in many countries, Southeast Asia, Africa, and this involves Vietnam, Cambodia, China, Laos, and Korea, and then many countries in Africa. I won't name them, it's too long. We actually do, as the network of Institut Pasteur, a lot of surveillance. And 3 years ago, actually, we started talking with DHSS, so in your country, and signed an agreement with actually Alex Azar, who was in the room. At the time, he was at the HSS. And we signed an agreement that for 3 years we've been working together with DHHS, our institution, and the French Ministry of Health has been helping too, in order to do surveillance globally. And more recently, we signed an agreement with CDC. And the kind of my vision of what we should do as an institution, because we have all these institutes over the world, is that none of us, even Bill Gates, and he's of course much richer than we are, none of us is going to solve any of the world health problem, because not only you need money, but you need human resources, as Robert was saying, this is very important. And you need local actors, and you need all kinds of ways to do it. And so my vision is that we have to work together among different international organizations, regional, local, to put our efforts together for something like H1N1, avian flu, or anything that will happen. Other things will happen. I mean, all the conditions are there so that every year there is another one. So we have been working in order to open our network and work with other international institutions so that we share the knowledge. And so, for instance, our agreement with DHSL involved training, but it also involved communication means. And this is not so simple. In some countries like Cambodia and Vietnam, you don't put a computer for communication and giving information in other countries like that. So it needed our very good insertion in the country so that we do that, so that we do the surveillance, and then when we get the information, we share it. So there is a lot of improvement in that, and we are working hard on that. It's not perfect, it has to improve, but clearly we are working very hard on that. And I would like to insist on what Robert was saying about the human resources and brain drain. I think this is extremely important, and I advocate for that all the time, so I'll do it again. I don't know if it's useful, but at least I try. Organizations like the Gates and the others are great because they bring a lot of money for treatment and for vaccines and medicines. But there are not many organizations which have a lot of money who work on sustainability by training people. And training people is not the most important. The most important to me is offering conditions in the country so that the people who are trained come back. I mean, any good scientist, a doctor trained in Africa, goes back, there is nowhere to work, and he goes to NIH, or he goes to Europe, or he comes to Institut Pasteur, or wherever. And this is a disaster. We have wonderfully trained people, or they go to international organizations, because every international organization has to have his or her black woman, right? So to be politically correct, I'm sorry, but again, it's true. And this is terrible. So we need to have organizations that build ways, build institutions, and give money for people to come back and start their research group, their medical group, so that it is the same for them to go back to their region as to go to NIH. And otherwise, we're not going to solve the problems, because human resources are what is lacking and are what is going to give sustainability. Suppose Mr. Gates in 20 years from now decides he doesn't want to do this anymore and wants to do something else. And then what? So the countries are just, we poured our money. I mean, I'm not speaking of my money, of course, but we rich countries pour our money, and then what? I mean, if we don't build up the country so that they take over the power and do it, it will be even worse 20 years from now. And I don't know what Mr. Gates will do and Mr. Warren Buffett or whoever, but we have to plan for that. I mean, it's not enough. It's great what is being done. It's not enough because it's not looking enough for sustainability in the 10, 20, 30 years. And this is done only with people.
Anneta, a question coming back to something you said. I had the opportunity to attend the Budapest seminar, the conference in 2007, and Time magazine at the time ran a cover story on the globalization of breast cancer, still archived at time.com and easily searchable. And one of the things I noticed then, and one of the things you mentioned here, was the question of cultural taboos. The fact that there are countries in which breast cancer is not only a source of fear for the woman who's suffering from it, but a source of shame. Is it realistic, or is there a whiff of, for lack of a better term, paternalism in thinking that we, as Komen as a Western group, say, can enter a country where there's a very complicated cultural history about this kind of thing and bring enlightenment, so hundreds or thousands of years of cultural teaching are overcome with a little tutelage from the West? Or is this something we're knocking our heads against and may not ever crack?
I think it's not something that's going to change overnight, but I really do think with our model of working through local organizations, through local individuals who have a credible voice, who can navigate this one step at a time, I do think that we can begin to make some inroads. I used Saudi as an example before, and we have Dr. Samia there who has organized some awareness campaigns that really work in Saudi. What we're also finding is many of our organizations, especially in Africa and in the Middle East, where the cultural taboos are probably the strongest, they start by educating the youth. Because they say the way that they're really going to address these cultural taboos, it's very difficult to change in terms of the older populations, and they're hoping that through training or raising awareness with the youth, they can influence the older generations, but also at least when these young men and women become of age where they are dealing with this disease, that awareness is already existing. There are programs, our representative in South Africa said, where they have 13 and 14-year-olds doing breast self-exams so that they're familiar with it and they're comfortable with it at a young age, so that when they are in their 40s and 50s, when they might have to really be doing this seriously, they're much more comfortable with it. So I do think it's possible. It's not going to happen overnight, and it's really, really critical that we work through the local organizations to be able to do that. Each one has their way of really trying to achieve this goal. And that's why, quite frankly, many of our collaborators in these countries are survivors themselves, because they've experienced it and they know what can't be done, but they also have hope and optimism about what can be done.
Right. And we have, I'm going to ask one more question sort of as a jump ball for the panel. Anyone who wants to answer it would be great, and then we'll have time for one or two questions from the audience. Muhammad Yunus won the Nobel Peace Prize 2 years ago for the idea of microloans. And more, as we look at what models work in global health diplomacy, it's often the tiny microscale on the ground project. It's Riders for Health in Africa who simply repair motorcycles and off-road vehicles so that people can get to hospitals and healthcare can get out to off-road areas. It's grandmothers in, I believe, Nepal, making sure vitamin A or vitamin E is distributed when people weren't taking it. It's that kind of laser-targeted care being given. These are great feel-good stories. And with the possible exception of Muhammad Yunus, since his bank is now a global operation, are they a whole lot more than feel-good stories, or will the model still have to maintain a very, very large-scale structure in order to be effective? Yes.
I can say, because we work with the organization Planet Finance and Microfinance, mainly in Africa. I think it's a very good solution in terms of development globally. In terms of health, it's a little different. But how we use for health, when you give money, you make a loan of money for a lady in Benin, in Africa, they have to reimburse, you know. But if she's sick, or children is sick, she can't reimburse. It's why health is very important. And they build health program to be aware about how to treat malaria, how to protect mosquito bites, because after you can work and you can reimburse. And through this process, I think it can bring something, because it's many. It's one of the solutions. It's one of the solutions, because when you make the amount of money through the Microfinance Institute, it's much more the Gates Foundation and some others. But it's much more on development, but indirectly, you know, you have no development without health, and no health without development. It's why the wedding between health and development is very important, is one of the solutions.
Anyone in the audience? Yep. Yes.
I have a question about accountability and about lines of responsibility. The old diplomacy conducted by governments had clear lines of responsibility. I mean, Quai d'Orsay is part of the French government, responsible to the electorate. The new diplomacy seems to be run by foundations, NGOs, corporations, and the like. So what are the new accountability lines for the new diplomacy? What I'm asking is, who is Bill Gates really accountable to?
Would anyone like to answer that? Would anyone dare to answer that?
Now the debate. Perhaps Alice, you wanted.
And this doesn't include Melinda Gates, by the way. We assume he's accountable to her.
No, the debate is it normal that a private structure has the power to conduct such public health policy? This is the main question. The only concern also is to say, are they professional or not? Today, when you see what I know from Bill and Melinda Gates Foundation, they are really professional. Now it's 760 people working in Seattle. It's about WHO. And they've taken the big specialists from private sector, from international organization. And what is also very important that they are not working alone. They work what they call through PDPs, Product Development Program. And for malaria, MMV, from TB, TB Alliance, from many, many things. Where you have public, you have private, you have NGO, you have pharmaceutical industry. And I think it's something as a security, I think, about. But after this is the evaluation, when we'll say, okay, today everything is nice, we have Global Fund, we have Bill Gates, we have money, and within 5 years we'll check what about malaria in developing world. What are the results? Today everybody is nice. We work together, etc. But now, what will be in 5 years? Because we have the means. The excuse we have no money for developing countries is finished. Money exists. The problem is not money. For some disease, and for all, if you take TB, HIV, and malaria, you have money. But you need human resources, etc. But what will be the result within 5 years? We'll see.
I think that Gates is also not operating completely independently. You mentioned the people that they work with, but also the governments are involved, and there are people in HHS that are involved, and NIH are involved, and so there are a lot of people involved in sort of evaluating what goes on in these countries. That's kind of, also there's no profit that has to be made, which is sort of an important element.
That's a different issue. There's an issue of accountability and sustainability, which is exactly what Alice mentioned. What's to guarantee that those funds will be there 20 years from now?
Well, I think accountability is okay. Sustainability is another issue. And that's what people need to think about as they look at the progress of this thing. But no, there's no guarantee. There's no guarantee you won't be hit by a car as you walk across the street. Right? But I think you won't.
Yeah, I'd like to say something because I agree with you. Some NGOs are really, I mean, not all NGOs are good. And I know some NGOs operating in Southeast Asia who, under the supposedly helping for health, actually have religious activities and actually are very bad. And I don't know who they are accountable to. So I think then, of course, it's a real problem, and then public opinion in one way or another has to speak out and be very active in the country. And it does happen a lot. I mean, it's not the case of Gates, but there are others where it really is a problem. So yes, the accountability is an issue, and it's not solved everywhere. As Robert was saying, la vie n'est pas toujours rose, as we say in French.
C'est sûr.
Any other? Yes.
Along the point of accountability, I think as we do these implementation programs in low and middle income settings, it's quite important that we collect data that shows outcome. Because if we develop a program and show that look at the improvement we've made, it becomes much harder for a government that for political reasons is less interested to withdraw or fail to support. But I think, so going and doing good things is a great idea, but you have to link it to research and data collection so you really know what you did.
Would anyone care to comment on that? I think it's a very good point. If you can't show outcomes, you can't support the program.
Yeah, I mean, being supporters of the BHGI that we've worked together with Ben, I think that really is important, which is why, again, as we implement our programs, we try to put in metrics of success. We are trying to understand measuring awareness, measuring the incidence of cancer and the mortality rates. And we're in it for the long haul. It's not going to happen overnight, but I think absolutely creating those bridges between the patients and the medical and the scientific community and being able to measure outcomes is critical.
I think that's some plus of having the business mentality on these people, because they are very results-oriented and metrics-oriented and trying to check and see whether they are being successful in these activities. No, that's extremely important.
And as funds become scarcer and scarcer, I mean, we need to also be that much more accountable to everything that we do. Every dollar that we put into these countries really needs to work for us because they're harder to come by.
Yeah, I think it's very important that there must be science in there, really measure. I mean, goodwill is not enough, and sometimes you can make very big mistakes with goodwill. And I'll take one example. Bed nets were distributed in many countries, and without measuring the effect. And this is some years ago because now it's much better. And then it turned out that in some countries, bed nets were actually distributed for the kids, but the father was sleeping under that because the most important person is the father. And in other countries, they were using it for fishing because they were fishermen and they needed something to fish. And so measuring, so you pour money, you buy bed nets. There is nothing more simple than bed nets. You put it over a bed. I mean, this is not big medicine. But then not measuring the outcome of the efficiency of how many bed nets you have distributed and the efficiency on malaria doesn't tell you what's happening, and I think it's extremely important. And goodwill is not enough. We make a lot of mistakes with our goodwills of rich European and North American countries, so measuring is extremely important.
Did you want to have the final word? And we've just gotten the 1 minute signal.
I know that, Jeff, you wrote something about complexity and what is simple and what is complex.
Available at all fine bookstores.
Yes, I've seen. No, but I just want to say something. Public health is really very complex. And I am very sad when I read on newspaper, even on radio, not news on time, but that the solution will be this one. You got bed nets, I fully agree. If you don't explain to the mother the link between mosquito and the disease, why they will use bed nets, they prefer to use a wedding dress or to fish. Yeah. The reality. It's very complicated. It's why to give simple to say, the bad guy are pharmaceutical industry. Just one example. Today, and as a specialist, I forget my hat of pharma industry, you will give all the product against AIDS free in Africa. Okay. We give you everything. You are not going to solve the AIDS problem. Can give the example. I know that you are very sensitive to children. Every year, 600,000 children are born HIV positive by mother and child transmission. We have now a product, a very easy one. You give one pill to the mother just before, and you decrease from 90% the transmission. It's very easy. We give one pill, it's finished. The pill is not expensive. Okay, but in Africa, you are not going to clinics or hospital. You make it at home. First, you need a program to explain to the mother when she painful, she has to take the pill. She has to keep the drug to give before. Education is not easy. First point. Second point, okay, she will take. Second point, if you don't treat the mother, the child will be an orphan. You have to be sure that the mother will be included in a program to treat AIDS. And to treat AIDS is not 3 days or 6 months. It's all the life. To be sure that we'll have the problem. But you need every 3 months to make some biological test to check viral load, to check the number of CD4. If not, you will have mutant strains or resistant. But to be sure. Second difficulties. Third one. We say that breastfeeding is very important. We made campaign all around. Now we know that the virus is coming in the breast, in the milk. And during a few months before the efficacy of the treatment for the mother, you say to the mother, don't give breast. You have to give milk with powder. But in the village, if it's not breastfeeding, say, this mother, she is HIV positive. It's a stigmatization. Just with it's a caricature example, three main difficulties. It's not simple. Public health is very complicated one. And don't say this solution is a good solution. It's why all together, public, private, diplomat, no diplomat, journalist, etc., all together, we have to work together to fulfill the gap between North and South. Sorry.
Thank you. On that note, thank you very much. And thanks to the panel.